we think about protecting our heart, most of us focus on what we eat during the day or how much we exercise, but one of the most overlooked aspects of heart health is what happens in the hours before we go to sleep. Because the truth is that your nighttime routine has a direct and powerful influence on your cardiovascular system, your blood pressure regulation, your stress hormone levels, and even the way your heart recovers and repairs itself overnight. And as a cardiac surgeon, I often see patients who are disciplined about their medications and diet, yet unknowingly follow bedtime habits that quietly work against their heart health. So today I want to walk you through 5 common bedtime habits that could be secretly hurting your heart, starting with the first one, which is late night eating, because when you consume heavy meals close to bedtime, your body is forced to stay metabolically active when it should be winding down. Digestion requires increased blood flow and energy, which can interfere with your heart's ability to enter a restful state, and this can also lead to acid reflux, poor sleep quality, and fluctuations in blood sugar levels, all of which place additional stress on the cardiovascular system. And over time, this habit can contribute to weight gain, increased cholesterol levels, and higher blood pressure, making it particularly risky for individuals who already have heart disease or are recovering from surgery. The second habit is excessive screen time before bed, something that has become extremely common in today's digital world, because exposure to blue light from phones, tablets, and television suppresses the production of melatonin, the hormone responsible for regulating sleep, and when your sleep cycle is disrupted, your body does not get the deep restorative sleep it needs, which can lead to increased levels of stress hormones like cortisol, elevated heart rate, and higher blood pressure during the night. And over time, poor sleep quality has been strongly linked to an increased risk of heart disease, arrhythmias, and even heart attacks. The third habit is going to bed with unresolved stress or anxiety, and this is something many people underestimate, because emotional stress does not simply disappear when you lie down. Instead, it activates your sympathetic nervous system, keeping your body in a state of alertness. Your heart rate remains elevated, your blood vessels stay constricted, and your blood pressure may remain higher than normal, and this prevents the cardiovascular system from entering a state of relaxation and recovery, which is essential for long-term heart health. And in some patients, this can even lead to nighttime palpitations or disturbed sleep. The fourth habit is irregular sleep timing, where individuals go to bed at different times each night or do not maintain a consistent sleep schedule, because your body operates on a circadian rhythm, and when this rhythm is disrupted, it affects hormone balance, metabolism, and cardiovascular stability. Studies have shown that irregular sleep patterns are associated with higher risks of hypertension, obesity, and heart disease, and maintaining a consistent sleep schedule helps regulate blood pressure and supports overall cardiac function. And finally, the fifth habit is inadequate sleep duration, because consistently sleeping less than the recommended amount, typically around 7 to 8 hours for most adults, prevents the body from completing essential repair processes. During deep sleep, the heart rate slows, blood pressure drops, and the body engages in healing and restoration. And when this process is cut short, it can lead to chronic elevation of blood pressure, increased inflammation, and higher risk of cardiovascular events over time. And what is important to understand is that these habits do not cause immediate symptoms, which is why they are often ignored, but their impact accumulates gradually, silently, increasing strain on the heart. So the key takeaway here is not just to avoid these habits, but to replace them with healthier alternatives, such as finishing your meals at least 2 to 3 hours before bedtime, reducing screen exposure, and switching to calming activities like reading or light music, practicing relaxation techniques such as deep breathing or mindfulness to reduce stress, maintaining a fixed sleep schedule even on weekends, and prioritizing sufficient sleep duration as a non-negotiable part of your health routine, because your heart does not rest just because you are asleep. It uses that time to recover, reset, and prepare for the next day. And by creating a heart-friendly bedtime routine, you are giving your body the best possible environment to heal and function optimally. And if you or your loved one has undergone heart surgery, these habits become even more critical, because recovery is not just about what happens in the hospital, but what you consistently do at home, especially during the quiet hours of the night. So if you take away one message from this discussion, let it be this: small changes in your bedtime routine can have a profound impact on your heart health over time. and by becoming aware of these hidden habits, you can take control of your nightly routine and turn it into a powerful tool for protecting your heart.